Hello and welcome. We'll get started in just a couple of minutes. Welcome everyone. We're glad you're joining us today. We're going to get started in just 1 minute. Thank you all for joining. We're going to get started at 2:03, just a little bit longer. Thanks for hanging in. And if we could go ahead and tee up the next slide, that'd be great. All right, everyone, welcome. We're so glad you're here. We are really excited to talk with you all, specifically about planning for the upcoming school year, how cities are adapting their pre-K programs in the era of COVID-19. Next slide, please. My name is Catherine Patterson, and I'm the Director of Operations for CityHealth. And I'm joined today by my colleague and co-host, Gigi Weisenfeld. Gigi is an assistant research professor at the National Institute for Early Education Research, which is also known as NIEER. Next slide, please. I'm going to leave this slide up for just a second. It's just a tutorial for how to ask a question. We really do want folks to submit questions, feedback in the chat box. We want to make this as interactive as possible. We have a lot of speakers and we want to engage with you all. What's really important is that you do let us know your name and affiliation so I can call that out when I ask your question. We will pause at the end of our speaker's remarks and address a few of your questions. If I don't have an opportunity to get to it, we will come back at the end when we have an extended Q&A period. Next slide, please. So if some of you are asking, what is CityHealth and what does it have to do with pre-K? I'd just like to share really quickly that we are a project of the De Beaumont Foundation and Kaiser Permanente, and we advance a set of policies that try to help people live longer, healthier lives within American cities. We also regularly assess cities on a gold, silver, bronze, or no medal platform. Next slide, please. So what are those 9 policies? You can see here, this is just a snapshot of what we work on. It's everything from affordable housing, to safe streets, to public safety, to earned sick leave, which is incredibly important now more than ever. We also look at things like safe and healthy food procurement. We look at tobacco control laws. And then most relevant for today, we work specifically with NIEER on high quality pre-K. Next slide, please. So something that's really unique about CityHealth's work is that not only do we assess cities on this 9 policy platform, but we also work directly with cities if they want to move up in their medal rankings. And that can look like technical assistance, it can look like model policy language, or it can look like specific resources that your city might need in order to advance a policy goal. At the very end of this webinar, I'm going to share a slide specifically about how to get in touch with us. It has my contact information. It has information about how to join our newsletter. I will make sure to circle back to that. If you want to get in touch, we do want to hear from you. Next slide, please. So here's a list of our fabulous speakers today. I am so excited to hear from all of these folks, but I will also say I'm also really excited to hear from you all. Look, none of us have all the answers. I think we're all trying to do our best We are trying to look at the science. We are trying to look at data. We're trying to figure out what's developmentally appropriate. But we're doing this all in an era of uncertainty. None of us have a crystal ball. I will say that the four of our speakers today all have the best goals in mind for children, families, and all of the staff who work within pre-K settings. This is really hard stuff. You guys know this better than I, but I'm hoping that by surfacing some challenges and some of the potential solutions to those challenges, that we can think about how to plan better together. And with that, I will turn it over to my colleague, Gigi. Gigi.
Thanks, Catherine. I just want to say that at NIEER, we are thrilled to partner with CityHealth, and in particular, you, Catherine, for just both the vision and compassion you have in supporting pre-K at the city level. Next slide. So during the spring of 2020, we heard almost exclusively about childcare, and in particular, the needs of families, most notably first responders, and then the unfortunate financial crisis many childcare providers were and continue to face. This summer, the conversation has expanded and included what is happening in public schools, a place where many of our pre-K programs are housed. However, the focus has been on grades kindergarten through 12, and we think not enough attention to preschool. And when I talk about pre-K, I mean programs that support early learning and development. Pre-K programs may serve children's needs, childcare needs of families through offering longer school days and or blending funds with childcare. The cities that have these programs often operate in mixed delivery systems. Next slide. What we saw in terms of pre-K after the pandemic hit was what is often referred to as remote preschool. Remote preschool is not preschool. And I really love the quote from Steve Barnett, the senior co-director and founder of NIEER. Technology is one important tool for early education, but computer programs are not a substitute for real preschool any more than the wooden puppet Pinocchio was a real boy. Most of these remote efforts required preschoolers to use a device. Of course, there were some exceptions, and I will share at least one resource from California created by the District Innovation and Leadership for Early Education. And I'm going to put it right in the chat box for everybody. Sorry, I should have, hopefully it went through. Yeah, there it goes. And I know there will be some other resources we hear about today. But when using a technology-based program, there are some serious equity issues in terms of access, who has access to materials and Wi-Fi, and safety issues that require adult presence when a young child is on a device. The American Academy of Pediatrics maintains its screen time limitations based on what the research says about how it affects young children and their developing brains. Virtual programs tend to be literacy focused, not the whole child, and most effective in constrained skills, such as being able to recognize letters, versus those unconstrained skills, such as developing a love of reading. Next slide. As we prepare for the fall of 2020, there are a number of questions. First and foremost, will we have preschool teachers in there when the children come back? Most states have issued guidelines for reopening schools, but it's really up to school districts to identify actual implementation plans. We are starting to see some of those school district plans, which are changing daily and being updated, which do integrate state and city opening mandates set by governors and mayors, but not all specify pre-K. There's still a lot of uncertainty. For those pre-K programs not located in public schools, we are hearing about possible shortages due to center closings and or not having as many seats available due to reduction in class sizes and or student-teacher ratios. According to the survey of 5,000 childcare providers by the National Association for the Education of Young Children survey that was released just this past Monday, some 40% of the childcare providers that existed pre-pandemic expect to close permanently unless they get some public assistance funds soon. And I will put a copy of their survey results in the chat box. On the plus side, we're also learning about new partnerships being formed among early childhood providers and school districts to better serve children and families. Of course, we need to consider the health and safety of the environment. I'm not a public health expert, and I'm glad that we have one on our call today, but we also turn to the CDC and the American Academy of Pediatrics, who have both put out guidance in terms of physical space and other considerations. There are some similarities with a few notable differences, mainly the required social distancing spacing, 3 feet versus 6 feet, and I'll put both of those links in if you haven't seen them. Other policies that are currently being developed include reporting and closing protocols if a child or staff member tests positive. Do you notify the public school if you're in the childcare setting? Do you notify the childcare setting if you're in the public school, and vice versa? Next slide. So at NIEER, we're constantly thinking of some of the bigger questions, and here's just the beginning list of those. But how will the role of teachers change in the fall of 2020? And we've been hearing more and more about this, but will wearing masks affect children's speech and language development, as well as their social emotional understanding? Children need to see our faces. How do we make that happen in a safe way? Once pre-K programs reopen in person, how will we collect information and communicate infections among ECE providers and schools? And another question is, what impact will this pandemic have on city pre-K budgets in both the short and long term? Next slide. I'm going to hand this back to Catherine.
Gigi, thank you so much. That was a great overview of some of the high-level questions that I think all of us are grappling with. It was a great overview. I'm now going to turn it over to Gibby Harris. Gibby is the Public Health Director in Mecklenburg County. Gibby, thank you so much for being here with us today.
I appreciate the opportunity to talk to the group. There are so many health directors across the state and this entire country that are working in this every day. And the one thing that I can say with certainty is that each of us have our own specific communities with their own specific needs. So I want to make sure that as we talk about this, people can hopefully glean a little bit from what I have to say, but also understand that the health director in their jurisdiction is the person that can help them the most as they try to build these things out. So next slide, please. So just to start off by talking about a few things that you need to consider as you're looking at what your school year is going to look like this year. The epidemiology in your community is critical because it varies from community to community. We're seeing that across states as well. Some states are having major issues right now while others are not. But the other thing you need to understand is that epidemiology changes on almost a daily basis. And staying in tune with that and understanding what's happening in your specific jurisdiction will help you in your decision making. The one thing that I've told all of the school system and the universities and the pre-K and the childcare that I've been working with, as well as businesses and everyone else, is develop your plans, but always have contingency plans. Because as we've seen in the last, just in the last couple of weeks, that situations can change rapidly, and you're going to need to be able to respond rapidly depending on what's going on in your area. You also need to pay attention to your state and local orders. The state orders are usually more general. Local orders can be more specific to what's going on in your jurisdiction. In North Carolina, we have 100 counties. We have 85 local health departments. And so we get general guidance from the state, but what works in Mecklenburg, which is the most populated county in the state, doesn't work in a county of 9,000 individuals. So, you know, make sure that you understand your state orders, but the local ones are very critical. You need to consider whether you'll actually be able to protect the children and the employees who are at higher risk for severe illness. We want to make sure that we're protecting everybody when they come back into these settings. That is critical, but if you have children with special needs, as well as adults who work in your pre-K settings, with special needs, you need to make sure that you're able to address those needs, whether those individuals are targeted for virtual services as opposed to being on site. You just need to think through that. You also need to think critically about your environment. What do you have the capacity to provide? How many children can you serve and still be able to social distance? We know in the pre-K setting, I had a conversation with my daughter last night who said, my 7-year-old is not going to leave a mask on all day. How are you going to be able to accommodate children in these settings and make sure that you've got the space and the accommodations that you need as you move forward with this? So just a few things for you to consider. Next slide, please. I wanted to talk just a little bit about my specific setting here in Mecklenburg County. Mecklenburg is a county that has a population of about 1.1 million. We sit on the border of South Carolina, which creates additional issues for us because we have parents who work in Mecklenburg and who bring their children into Mecklenburg for school, for pre-K, as well as, and you know, the issues related to having different recommendations and guidelines from 2 different states just complicates things. So again, making sure that you understand your surroundings and the requirements in those settings. We have 2 pre-K programs. One is through our school system, where they do actually provide pre-K within the school setting. And then the other is MEC Pre-K, which provides slots within approved child care facilities. So that particular program is funded by the county and many entities in our community. It's very widespread at this point, and it's managed by our Smart Start program here in the county. But again, the challenges for that particular program is that they are working with multiple child care sites, and the complications of trying to make sure that everybody has what they need and can implement appropriately. And we also, our county program, the MEC Pre-K, has agreed to align with the CMS, our school systems reopening plans. So that simplified things for us in terms of how we work with those systems and provide guidance for them. Next slide. Thank you. I mentioned earlier when I was talking to the group of presenters that our governor announced his guidance and basically his orders for school openings for the fall yesterday afternoon. So everybody's been planning, and we knew that there were 3 potential plans that he was going to recommend from. And so everybody has been looking at all 3 plans and what they may be able to do within those plans. He came down with Plan B. So the recommendations are really to provide seats for children at no more than 50% at a time. So schools are, just including pre-Ks, are considering what that means based on their location and their ability to accommodate that. Some are looking at going ahead and having 50% of children in one week, 50% in the next. Others are saying we can't socially distance and accommodate 50% of our children. Therefore, we're doing 30, 30, 30. So the children would come in every 3 weeks. It's really varying, but again, having to look at your jurisdiction and understanding what the capabilities are there. The opportunity for remote learning continues to exist, and that will be built into everybody's plans. Many of the jurisdictions in North Carolina are saying, if you can remotely, if you are interested in remote learning, we'll make that happen. If you're interested in bringing your kids into the schools, that happens as well. And I would imagine that all of you are experiencing the same things we are. We have parents who are adamant they want their children in the schools. It's the best thing for their kids. And then we have parents who are saying, no way, I'm not bringing them back in. It's not safe. I don't want them there. So our governor and at the local level, we're trying to accommodate both sets of families and what their needs are. Next slide. So I wanted to talk briefly about the public health guidance and support that we've been providing for the school systems here, and that I would hope that each of your local jurisdictions can provide to you as well if they have not already been involved with you. We've been working with our school systems and our pre-K for 2 to 3 months now to provide guidance as they develop their plans. We are not in any way going to make specific recommendations about what the schools do in terms of how many kids they bring in, those sorts of things. That's your decision. Y'all understand the learning needs of your children. That's where your expertise is. What we have to think about is what are the public health implications for our community as a whole. And the other thing we were talking about earlier was the fact that this is an incredibly complicated situation. You can't pull one string and expect that that's the only thing that's going to be affected by that one string. So we talk about opening schools or not opening schools, the impact that that has on people's livelihoods, on parents' ability to juggle systems or their work and able to get kids to school half-time or quarter time or third time, whatever that happens to be. It impacts those individuals who teach and provide services in those schools. We know that we have teachers, we have bus drivers, we have people that do food in the schools, that clean the schools. All of them have concerns about opening back up again. And so how do we balance all of those different needs in thinking about what we do with our schools? So some of the things we've done with our schools is help them with developing screening protocols. And that includes guidance about when not to come to school. So how do we create a screening protocol, then you screen, so then what do you do next? Luckily in Mecklenburg County, we have a school system that's a school health program that's through the health department. We provide a nurse for every school in our county. So we will have some resources within the schools to help teachers and principals make decisions about whether this child needs to stay in school, whether they don't need to stay in school. But that's something that you need to think about and have in place ahead of time. Developing cleaning protocols. There are any number of protocols out there. Our state has done a great job of providing some specifics. And again, a lot of it depends on what you can access, whether you can get those supplies that you need. PPE is another issue. We got a list today from our school system of all of the PPE, the protective equipment that they're going to need to be able to open. It's astronomical. And then you add the cleaning supplies on top of that. You need to make sure that you have access to those things. We're helping and training all staff, specifically on the specific public health issues. We're helping them develop communication with parents. That's got to be done in advance. There's got to be clear expectations and instructions. You've got to decide whether you're going to let volunteers back into the school or not. Are you putting other people at risk by doing that? Are you putting the children at risk by doing that? You've got to think through those things. Mapping out all the spaces in the school to promote social distancing. I know our school system is looking at one-way traffic in the hallways. They're looking at children not going into the cafeteria for lunch. They're doing lots of different things along those lines to figure that out. We are willing to work with you on that if that's helpful. We are providing guidance on postponing non-critical gatherings and events and thinking about sports. And that's not as big a deal in pre-K, but how do you operate on a playground during a COVID pandemic? What does that look like, and what does it need to look like? Requiring face coverings. I will tell you, this has been a real challenging message since the beginning. Like many things with COVID, it continues to change and evolve as we do more research, as we learn more. In conversation with the CDC director this week, we have more and more evidence that face coverings, if we all wear them, have a significant impact on the spread of this virus. So we want to make sure that as kids and adults come back into our school setting, that people are wearing these face coverings unless there is a physical or emotional reason for them not to. Because we are finding that that is one of the most protective things that we can do. There are ways to wear face coverings and ways not to wear face coverings. Public health can help you think through those things as you develop protocols, and can help you with training that you can do for students as well as for the teachers around that. Teaching students about hand washing, wearing masks and social distancing, providing some information and some teaching tools for our schools to help with that, creating messaging and signage in the schools around these things as well, making sure that It's sort of like what we call the McDonald's message. It's in your face all the time. It's hard to ignore when it's in your face all the time. So how do you post that in schools? Developing plans for addressing staff and children who become ill at school. You need to know how you're going to address that. And the one thing that I will strongly recommend, that if you don't have a relationship with your local health department, that you develop that, because you're going to have instances where you have a situation in your school where you have a child or several children in a classroom that have become positive, or a teacher who's become positive. You want to have resources to good people that can help you figure out how to appropriately deal with that particular situation. The knee-jerk reaction is to close the center down. You don't necessarily need to close the center down. It depends on how you've been doing your social distancing, face covers, washing hands, keeping the children in their classrooms, those sorts of things. We can help you manage that, but I would suggest that you don't wait until you have one of those situations to develop that relationship with local public health. And the last slide, please. And I just want to reemphasize, these are the things that we know work. We do not have a vaccine. We do not have a cure. This is going to be around for a while. We've got to learn to manage it. And right now, these are the three things that we know really have an impact on the spread of this virus. So I just want to reemphasize that this is something we need to do. I know this is going to be incredibly challenging in a preschool setting where you have young children who are going to want to hug each other and are going to want to share everything and are going to want to be close and do all of the things that children of that age do. But I just continue to reemphasize that these are the things that are going to make a difference. So as teachers, my father was a teacher. I thank God for teachers. I was never cut out to be one. Whatever you can do to make this fun and to make it a game, I'm assuming will help you in implementing these things in your school. So I will stop there. Thank you.
Gibby, thank you so much. I have a couple of specific questions that folks are curious about, particularly from you. So we have Christina from DC who asks, are the North Carolina health guidance recommendations, are they recommendations or requirements? And did North Carolina release any guidance around group size?
So what we're hearing at this, well, okay, the first answer is the governor did issue an order yesterday that he capped things at that Plan B, right? So he said Plan B is what he's recommending, which is, I think, up to 50% of the school environment. So if you've got 100 kids, you can bring 50 back at a time. And so that is part of his order. You can be more restrictive. You cannot be less restrictive. So you can't decide to open your school or your preschool 100%. You've got to do it at that 50% cap. So that is online, and they've issued some significant documents that I think are really helpful. And again, I'll reemphasize that those documents are really helpful, but what we try to do is bring them down to the local level and figure out how to implement them. Because lots of times guidance at the state and the federal level does not necessarily consider what that means on the ground when you're trying to implement. So we're trying to take some time to make sure we work through those things and get them to an implementable level with our preschools and our school systems.
Gotcha, that's great. And just one more question from you, because I know your time is very valuable and
that's okay.
You're being pulled in 1,000 different directions. But I have a question from Ellen Freedy who says, I'd like to ask Gibby to comment on whether masks and social distancing for 3- and 4-year-olds are really necessary in localities where the rate of spread is low. The cost to children and families of these hybrid models is lost education and lost work is such a risk. Also in light of low transmission with this age group.
So that's a great question. And there were lots of different parts to it, which is typical with this virus. Like I said before, there's nothing uncomplicated about it. Where there are places where there is low transmission, and what we are learning is that our children are not the super spreaders that they tend to be with upper respiratory viruses. Flu season is coming. I'll just warn you. I mean, we've got to think about flu season because that complicates this picture tremendously. You have a child coming to school, you're going to want to send them home if they've got a fever and the runny nose and the whole 9 yards. But trying to figure out whether it's COVID or flu and how quickly they can come back and what that means for others in the classroom, it becomes more complicated. But for COVID, we're not seeing, especially our young children, being the super spreaders that they tend to be with other viruses. And if you've got low numbers in your community, the reality that these children are going to be terribly infectious goes down. I do think there is concern, and understandable concern from the point of teachers and others that work in those settings wanting to be protected and also wanting to protect the children. So we know that they need to be masked. Children that can be masked should be, if that's an option. And again, making it a game. My medical director has 3-year-old twins and they just have a blast wearing their masks. But I think it's because of the way she's approached it with them. And any parent that can start working with their child to get used to wearing a mask at home before they come into a school or preschool setting would be beneficial.
Great. Thank you so much. And Gibby, we're going to let you go because you have lots of other things to take care of, but thank you so much for your time. And your
Thanks for having me. I'm going to stay on for just a little bit and see if there are other questions in the chat that I can answer.
Awesome. Thank you, Gibby. Next up, we have Leslie McKinley, who is the Deputy Chief in the Office of Early Childhood Education for the Chicago Public School System. Leslie?
Good afternoon. Thank you so much for this opportunity. As Catherine stated, my name is Leslie McKinley. I work with the Office of Early Childhood within Chicago Public Schools. So happy to be here. Within the district, we serve a little over 20,000 3- and 4-year-old students, and they're housed within a little over 350 schools. So as we're thinking about this pandemic and as we're thinking about how we support teaching and learning in this new way, I want to share with you some of the challenges that we faced during this COVID period and how our office worked across the city to collaborate to ensure that everyone in our pre-K programs, as well as in our community-based organizations, had the resources needed in order to teach and learn in a new way. So we have not yet released our guidance on how we are reopening the district, but we are hoping to hear something soon. But like everyone here has said, it's been very much on top of mind. We're looking at all of options across health and social emotional development, as well as educational supports and how we can reopen. Next slide, please. So when we were forced to think about this, there were 3 big areas that we had to really think about as a district. One was how will we define remote learning versus e-learning? Second, we had to think about opportunities to communicate, not only with our school staff, but as was mentioned earlier, how are we communicating this with families? And then we had to think about what are some of the equitable ways to share materials, resources, food and technology and all of the sorts. And so one of the things that the district created was a COVID-19 website page. If we can pull up that link. This website was really the sole source of how we communicated with families. It really made it easy for us to place where our food distribution centers were. It also was a place for us to put resources to families. So we put packets on there. We answered questions through there. And it was just really a nice one-stop shop for families as well as district staff to go to identify resources during this period. So once we figured out the best way to get information out and the best way to communicate not only with district staff and families, we also went to work with creating materials and resources. So as I said before, we had to figure out how to think and learn in this new way. So once we established that remote learning was what we were going to do in the district, I think it was mentioned earlier about the digital divide. That's very much the same sense in Chicago. We knew that there are limitations to access. And so one of the things that we created was this remote learning implementation guide. And it really talked about what remote learning would look like in this pre-K space. Now we know that a lot of emphasis in the older grades was really centered around digital. So a digital platform. And we know in pre-K that that really was not useful and what's best for our families. And so we wanted to give families an idea, and teachers really, to think about how they can begin to prepare for remote learning by thinking about activities. So whether it was a 15-minute read aloud, what would that look like with families? How could we communicate that? So we began by giving this resource that you see here to teachers to say, think about what skill levels activities have, think about reading resources, thinking about project-based learning that could happen, and start to help put that information together so that families could begin to access that information. So our teachers went back to thinking about ways that they could put 2-week interval resource learning packets together for families during the first phase of remote learning. And we held, after that, we held office hours for teachers and for administrators, just to talk about what remote learning looks like in pre-K, how to think about putting these activity packets together, how to think about checking in with families weekly to ensure that learning was happening, making sure that we're available for families who had questions. So we had probably over 1,000 or so of our network-based staff, whether it was principal, administrator, teacher assistant, visit those office hours to get that information on how best to prepare information to be able to support families during this remote period. Another thing we did was we surveyed our teachers. So after we did remote learning for a couple weeks, we wanted to survey teachers to see, because pre-K is such a unique space, we wanted to see what resources were they accessing outside of what we had provided, meaning our resource packets. And it was through that survey that we found that teachers said, hey, the remote packets are great, the resource packets are great, but where I'm really struggling is in technology. So how can I begin to use technology in a way that will help support this? And so our district utilizes Google Suites, and we know that with older grades, I have a 5th grader, they're on Google Classroom, they can submit work through Google Classroom. We know that doesn't work the same way with pre-K. And so we really wanted to give our teachers just some guidance around how to connect with families on Google, so how to utilize the Google Meet to be able to have some of those conversations with families, how to utilize Google Meets to have story time and really be able to access learning with children. And so we put this guidance together just to answer some of those questions that was gathered during our survey. And so that was really our approach to how we communicated with teachers and how we supported teachers and how we supported teacher learning and building their capacity to support families. When we started to think about, as an office, how can we get this information out to families, or how can we be a better support to families? One of the things that I created was Dialogue with the Deputy series. And this was a series that really was birthed and grown just out of the fact that we know how unique pre-K is, and we know that it's so much of a family-facing responsibility to help learn in this remote space. And so I created this series to really give parents voice and opportunity to access not only myself, but district staff so that they can ask questions. So we did the sessions in English and Spanish. The first session really centered around our remote learning packet and how to unpack that with families. So and it really talked them through how they could take everyday household things and have learning experiences with them. So, and also really talking about the importance of having conversations, because we know students at this young age learn through interactions and through relationships. So really talking with families on how to build upon that. The second one really centered on social emotional development. We knew that this was a trying time, and our young learners just are probably confused with why they're not at school with their friends and family. So we wanted to talk about what are some signs. And not only that, a lot of our families have older and younger children within the district. So we wanted to talk about what are some signs to share, how this may be affecting children and families themselves, and how to begin to have those conversations around it. I also shared that I have a 5th grader who is scared to walk out of the house. I mean, she just wants to stay inside. And so just starting to share with families how to begin to have those conversations to begin to address that, and that need to, a fear that's happening, and that need to want to stay inside. And so the next series really focused on really getting family input. So as the district is starting to think about how we reopen school, we wanted to hear from families. We wanted to have real feedback from families about this remote learning process, and also give them an opportunity where they can express their fears and the fears of their children around how we reopen school. And so this one was a different dialogue with the Deputy series, where it was a smaller size, and we really took time to document and note. We broke the families off into groups, and we spent time really documenting their experience so that we can use that as we think about ways to reopen. The other thing that I'm excited that we also created was our Chicago pre-e-learning website. We played on the pre, and this really came about as we tried to think about our community-based organizations within the city. So as I shared with you, the district had a website dedicated to all of the pre-K programs within CPS specifically, but we also wanted to provide resources and a way for our community-based learners to get access to the same quality and resource packets that we provided on our district site for pre-K 12. We wanted the same access for birth to 5. And so this was a place, we built this website during the COVID period for our community-based as well as school-based staff and families to access. And there are links to City of Chicago resources on there. There's also links to the wonderful resource packets that our district teachers raved about. And there's also links to digital platforms that could serve to be a resource for families as we think about how we remote learn. And then we also, in our guidance, want to also share that we follow the American Pediatrics recommendation on technology and all of that. So that information is also readily available for families. But this was created as a resource for our CBOs to access, and also for us to also share great teaching and learning that we see across the district. There is a space for educators to be able to share lessons learned and great resources. The other area that we tackled, which I mentioned, is equity and access. How are we distributing out our resources? And so one of the things that I'm happy to report is that the learning packets were given out at schools and hard copy, but they were also placed on websites. So we had that mix of those families who could access it digitally. If not, they could go to their local school, which is usually within their neighborhood, to access the information to get packets. We also had food distribution sites on that website. You saw where we had a site list of where families could go and get food for a couple days, every day of the week. And then we also utilize those food distribution centers for the Office of Early Childhood to provide materials to families. So one of the things that we provided to families was not only packets, but we also purchased iPads for our early childhood classrooms in the district. We also, to help support with the digital divide, we also allow teachers to send those iPads home with families who may have needed. The district also provided technology for families who were in need, and Wi-Fi services and devices to families who needed it. We also, as an office, purchased pre-learning kits. We customized some kits that would accompany our pre-learning packets that we sent home, with giving families the necessary resources, pencils, letters, books, things of that nature, so that as we're sending these packets home with families, they also had resources to go with the learning cards and learning activities that were prescribed. And then I think the next slide, please. We also talked about how we are reopening. And some of the information that we're using to reopen our schools is really our Be Safe Chicago, which is guidelines that was put out by the city of Chicago. We're also coupling that with guidance that was put out by Illinois State Board of Education. And so hopefully those two documents, as well as our family feedback and staff surveys, because the district is not only surveying families, they're surveying staff as well. And so all of that information will be used to guide how we open the district. Hopefully that guidance, like I said, will be coming forth within the next couple of weeks. But we also want to share that recommendations for implementation and guidance is really centered around definitely health and safety. We want to ensure that we're meeting CDC guidelines, CDPH guidelines, and Illinois Department of Health guidelines, but also thinking how we're also taking into account that this is an emotional and social emotional time for young learners and for families. So just realizing that that content needs to be embedded throughout, and really focusing, particularly for our kindergartners, really focusing on foundational skills because of the disruption in their pre-K experience. And hopefully, like I said, we have a task force that's really having thoughtful conversations and really thinking about this, not only across the district, but across the city, and coordinating with state. So I'm really excited to see what comes out of this collaborative work that's happening not only across the district, but across the state as well. Next slide, please. So as we think about the fall, I know that in our office, we're preparing for both in-person and remote until we hear like what it will actually look like. And I know that some of the things and some of the lessons learned that we experienced from what we learned doing remote learning from March until June will definitely help inform how we move this process forward, and really thinking about how we have heard from our teachers about what supports they need, and also how we're thinking about listening to families about how this process has impacted them will help us strategize how we continue to support, whether it's in person or whether it's remote. Next steps for us is really continuing to monitor just how our state unfolds during this pandemic, and really waiting the launch of our district's reopening plan, which are, like I said, we're really excited about, and continuing just to take into account the voice of the people who are really experiencing and going through this and learning and growing with us. So thank you.
Leslie, thank you so much. I'm just going to let you know all of the resources that you just shared, we're getting a ton of love in the chat box. So people loving how intentional they are, how comprehensive they are. For everybody on the webinar, we will be sharing these resources afterwards. But Leslie, incredible work in terms of what you're providing for everybody who's touched by this. I do have one question for you. This is from Sarah Walker. She says, are the activities and times recommended on your remote learning guide per day? for example, reading 20 minutes, skill practice 15 minutes, etc. And are those the same recommendations? Will they be the same for the fall of 2020?
So I want to clarify that the expectation is not that families do all of those activities in a day. So really we're thinking one activity per day with students, and that was meant to be like a week's worth of activities. So one day they could focus on a reading activity. The next day they could do like a project approach. And then the next day they could do something skill-based.
Got it. That's super helpful. Thank you for that.
Okay, no problem.
Thank you, ma'am. We are going to move on to our next speaker. Becca Patton is the Director of Early Care and Education for First 5 LA in Los Angeles. Becca?
Hi, everyone. I'm Becca Patton with First 5 LA, and thank you, Catherine. Really glad to be here today among some very impressive colleagues sort of throughout the US that are doing the really hard work of navigating early childhood education in the midst of a global pandemic. So really glad to be here. So for a little background on First 5 LA, we are an independent public agency with a goal to support the safe and healthy development of young children. So we were created by the voters in 1998 to invest our county's allocation of funds from a voter-approved proposition. And since then, we've invested $2.2 billion to improve the outcomes for children prenatal to age 5 and their families. So First 5 LA has been working in early childhood systems for a while, and in March, we pivoted our work to focus primarily on supporting children and families during the COVID pandemic, with a particular focus on childcare. And so I'm going to talk about sort of our experience over the past few months today. So next slide. So in mid-March, California was one of the first states to issue a statewide safer at home order. And as part of that safer at home order, childcare was deemed essential. And the field was actually asked to offer childcare for the rest of the essential workforce. So as we all know, childcare supply, infrastructure, and workforce has been deeply impacted by COVID and the subsequent safer at home order. So today I'm going to talk through some of the immediate short-term actions LA County took and the state of California took to help, hopefully in some small measure, to stabilize our childcare industry. And my hope is that you can learn from some of our lessons, even some of our mistakes, as we work to respond to the pandemic. I just want to be mindful that sort of the numbers you see on this slide are inclusive of all types of childcare. So we're including Head Start. We're also including our California State Preschool Program, and then childcare funded through TANF and CCDBG. So next slide, please. So once the safer at home order was issued, I, along with a lot of my colleagues, were on many calls, texts, and emails over a 6-day period, and it became very clear that we needed to start convening a core group of organizations and public agencies to provide a more coordinated response to the pandemic. So this group became known as the LA County ECE COVID-19 Response Team. So we're not winning awards for creativity in our naming, but hopefully had a little bit more creativity in our problem solving. So this group is currently co-convened by 3 public agencies. So First 5 LA, our county Office of Education, and actually our county Department of Public Health has an office for the advancement of early care and education, who is also convening this response team as well. It also includes representation from Mayor Garcetti's office, various school districts throughout LA County, including LAUSD, several of our resource and referral agencies, and philanthropy. And we started the pandemic with really just 2 objectives: ensuring access to childcare for the essential workforce, and then supporting childcare providers who remained open and operating under the new health and safety guidance that was released due to COVID-19. So next slide, please. So several problems revealed themselves very quickly, and I have kind of put these in a few different buckets that I'll walk through each one. And as you'll hear, sort of our thinking about each of these has kind of evolved over time. Before I dive into that though, a few things to note. LA County's system of childcare and preschool is a mixed delivery model. So we have home-based care, district-based care, and CBO center-based care. It goes without saying, LA County is a rather large county, but it's large both in population and also geography. So we're about 10 million people, but we're also over 4,000 square miles. It is also, which is not as well known, both very densely populated. So we have really strong urban cores throughout parts of LA City, but we also have fairly rural areas in places like the Antelope Valley. So one of the first hurdles we had to overcome was supply chain issues. So I think this is something we can all relate to. I had a moment probably in early April where I looked at my own personal supply of toilet paper and was trying to figure out how long I could actually make that last. And our childcare providers were in the same boat. So we first had to very quickly identify and distribute needed supplies, and found that the identification was just as complicated as the distribution. So we were able to identify supplies from our state agency, First Five California. We've also been relying on donations from organizations like Baby to Baby and IKEA. And so we have distributed over 1.5 million diapers, 57,000 face masks, 46,000 hand sanitizers, 28,000 bottles of hand soap, and sort of counting. We had a moment in April where sort of our largest task as a response team was to figure out what is the monthly supply that our childcare providers needed who were open of things like gloves and face masks, hand sanitizers, disinfecting equipment. Our distribution system became complicated because we are a very large geography. So we utilize sort of our existing infrastructure of our resource and referral agencies, and then set up a new relationship with a warehouse once we realized that none of our organizations knew sort of where or how to store or sort 268 pallets of supplies, which the state was sending to us in a matter of weeks. So we've smoothed out some of our issues around supply chains, and now we are moving into sort of how do we sustain those supplies and ensure that both childcare and preschool have access to the supplies they need for long term. The other piece that we had to focus on was the changes to the environment of our facilities. Fortunately, we do have the experience of having our Department of Public Health on the team with us, and we're able to work very closely with them on the updated physical distance guidance and safe health practices for providers. We ensured that this language was very early educator friendly, that it was translated into the appropriate languages, and we're able to work with them really closely on long-term or on real-time solutions to things like how do we utilize our outdoor space in a new way, because the virus behaves differently outside than it does inside. How do we create stable group sizes of 10, which is our guidance specific to LA County? How do we divide up classrooms in a way that will prohibit the spread of the environment, but maybe allows us to serve sort of 2 groups of 10 rather than just having that space for 1 group of 10? What does sort of a wellness check station look like? So really coming up with sort of these real-time solutions. We also realized that we needed to sort of broadly communicate this new guidance and what support we had available for providers, because it was changing on a regular basis. So we stood up a new website. We are also hosting bi-weekly community briefing webinars. We are in the process now of working with a communications firm to create like how-to videos. It's one thing to say that the children do need to wear masks and that the educators need to wear masks and they need to be physically distanced, but it's a whole other thing to be able to see it. So we're creating some how-to videos, some reopening checklists and templates, and we'll distribute those through the communication channels we've set up as well. And then the last piece that we looked at was actually putting together a data infrastructure. So we wanted to monitor not only the effectiveness of our response team, so who was coming to the webinars, who was visiting the website, how were they downloading the materials we're supplying, who's getting the supplies that we're providing, to make sure that we're sort of having some equity through our response team efforts. And we're also closely monitoring sort of the current supply and capacity of our childcare system in a very real-time way through the data that our resource and referral agencies are gathering on an every other week basis. So it's been a crazy few months, but we're sort of transitioning into new territory now as we look to the fall. Especially just this week, we received news that many of our K through 12 school districts in LA County will continue to operate virtually, including LUSD, which is our largest school district in LA County. And so how do we continue to balance the health and safety of the children and staff within our providers while also ensuring that we're supporting optimal child development? What impact does wearing a face mask all day have on a child who's sort of also learning language and literacy skills? How do we make sure that there's appropriate social interactions between children if they are physically distanced? And so these are things we do not have answers to, but we are working closely with sort of experts in the field and looking for real-time feedback and input from our childcare providers to see what solutions they're coming up with and how they're navigating this, this crisis. Next slide, please. So I would also sort of be remiss if I did not mention sort of advocacy's role in supporting us in our work. So First 5 LA also funds a statewide EC coalition, and this coalition was really able to ensure that childcare became sort of the central issue in our state's budget negotiations in late May and early June. So by doing so, we were able to stave off sort of a field-wide 10% budget reduction, which the rest of the budget was not as fortunate. We've also included over $400 million in reinvestments to support things like emergency supplies, reopening grants and stipends, and sort of emergency childcare vouchers. So I'm going to stop here. I know that was a lot of information, so happy to answer any questions.
That was great. Thank you so much. I do have one question for you that is specific to the work that you all are doing in LA. And this is from Chris Warnick, and he asks, how was your response team convened and how is it funded?
That's a great question. So I would say that a lot of us, so both our County Office of Education, First 5 LA, and our Department of Public Health has what we're calling sort of redeployed staff time. So this, figuring out how to distribute diapers to childcare providers was not my full-time job pre-March, but they've sort of redeployed, each of us have redeployed a number of staff, and then we're just really sort of utilizing existing funds that each of the organizations have. I will say philanthropy has been on at the table as well, and they have set up a pooled community fund that we're drawing down to do some infrastructure support. So the communications firm I just talked about, we're bringing that on board through that sort of pooled community fund, but philanthropy has also sort of provide funding for like emergency childcare vouchers as a stopgap measure until the state funding rolled in. So it's a lot of creativity, but a lot of it is just sort of redeploying existing staff time.
Gotcha. Thank you so much. And I'm going to keep us moving because we have one more speaker and we have a lot of questions that I want to make sure that we get to. So I'd like to introduce our final speaker, Joe Francaviglia, the Executive Director of Strong Schools Maryland. Joe.
Great. Thank you so much for having me, everyone. And thank you to everyone that's on this call, that's on the front lines and has been doing the service work for the last 4 months, and then everyone who's planning for this next phase. I am lucky enough to be sitting in the advocacy space, so what Becca just kind of left off with is where I'm going to pick up. And so I'm with an organization called Strong Schools Maryland. You can see our logo there and our website. And our whole mission is to essentially build world-class schools for every Maryland student. Next slide. So what I'm going to kind of walk through is some of the advocacy space, because while our immediate focus is on how to reopen schools, which is, makes sense, we do know that public education is going to be on the chopping block. We do know that budgets are going to have to be re-examined. And when we cut public education dollars, we not only harm students in the short term, we harm our structures and our systems in the long term, and we also create economic uncertainty over the long term, which then leads to this nasty cycle of budget cuts in the future because the economy isn't producing, because our students aren't educated, and it's this vicious cycle that we need to avoid. And so what I'm going to talk to everyone about today quickly is just who we are as an organization, what we've accomplished, what we've looked at, and some of the lessons we've learned from that, and hopefully things that you can then apply to the work that you do wherever you are. And then some of the things that we're looking at in the short term that hopefully you can also keep your eye on as things are happening. Next slide, please. And so our organization was born about 3 years ago in response to a very specific action that the government took, which I'll get into in the next slide. But what we do essentially is we go around the state and we organize folks to say, do you care about public education? If you do, get involved with us. We produce resources. We produce actions. You can see in the picture there, we ask people to form what we call teams of 10. All they need to do is gather people, and we give them everything else, all the way from readings for their team down to envelopes that are pre-addressed, pre-stamped, so they know who they're going to write to when they need to write to their elected leaders. And so what we've done is we built this grassroots army across the state of education activists, because one of our fundamental beliefs, and I think this probably is every state and every country, is it's not that we don't know how to solve these big, intractable problems. It's that we oftentimes lack the political will to actually get it done. So this is not a policy problem. This is a political will problem. And so we've designed an organization whose sole mission is to build that political will to make sure our students have world-class schools, which includes early childhood education. Next slide, please. And so that policy initiative, government action that I was talking about previously that we were formed around was something that was called the Commission on Innovation and Excellence in Education, which became nicknamed the Kirwan Commission based on the Chancellor, Britt Kirwan. So anyone from Maryland, he was the Chancellor of University of Maryland system. Anyone from Ohio State, he was from The Ohio State University as well. Anyone from any of the other 48 states or international, he did not live there. So sorry that there's no personal connection for you there. But it was this commission that was set up based on a bunch of lawsuits, policy, that we could go back to the 70s, but we're going to keep it moving here. That essentially we rewrote our education funding formula in 2002. We were supposed to look at it again in 2012, so 10 years later, but we were still in the middle of the Great Recession, and just like now, no one wants to look at budgets, no one wants to add resources to education, no one wants to raise taxes, no one wants to do anything that's politically risky, even if it's beneficial in the long term. And so that can got kicked down the road to 2013, 14, 15. Eventually in 2017, this can was picked up, and this commission was finally forced into formation from advocates. And their job was to essentially look at this funding formula. But through advocacy, we were able to broaden this charge from beyond, let's not talk about funding first. Let's actually say, what does it take to build world-class schools for every student in Maryland? And then let's worry about how much it costs. So we're not going to say we have $1 billion, what should we do with it? It's, we want to get kids from point A to point B. What do we need to do to get them there? And then what do we need to invest to make sure that happens? And so these 5 policy areas all have about 100 bullet points underneath. So they didn't just say, hey, do early childhood education. They had a very detailed plan on how to do that. But you can see one of the 5 pillars of how to reform an education system in a state was invest in early childhood education. Now, I'm sure no one on this call is shocked by that. But none of these are, things that haven't been talked about before. But it's all about getting that cohesive policy and everything building on each other. So a lot of times we talk about early childhood education is incredibly important, but we talk about it in a silo. Or we talk about paying teachers what they're worth, but we talk about that as a single policy fix. One of the things that was instrumental was wrapping all of these issues together, making them one cohesive unit, and making them interlocking. So if you were to take out one of the puzzle pieces, the whole thing would crumble. So it was no longer the early childhood education advocates versus the teacher advocates versus college and career advocates versus funding advocates. Everyone was able to join on the same team. And so we learned a lot of really critical lessons about that. And one of the key things that was really important for early childhood education that hopefully you can take away, and this was actually said to me earlier today, so I'm glad that this was later in the afternoon, but the most important thing in the early childhood education space, now we got pre-K3 and pre-K4, we got 0 to 3 programming, we got childcare subsidies, like those are all huge on their own, but the biggest win was actually a philosophical shift around early childhood education, where it was no longer K through 12 education and then early learning. It became a continuum of birth through 12, and now it's one integrated system. And that philosophical shift on its own was worth every, blood, sweat, and tear. But we got so much more on top of that. So if you could go to the next slide, I want to tell you a little bit about some of the lessons learned that hopefully you can take away as well. But what we ended up doing at Strong Schools Maryland, and all of these partners, which you can't really see on your screen because they're small, but if you go to marylandblueprint.org, you can see every member of this coalition. We were able to form a coalition of a ton of non-traditional allies and a ton of traditional allies at the same time that, when together, represented close to 400,000 Marylanders, all speaking with a common voice. Now, Strong Schools Maryland was a co-chair of this coalition, helped organize it, but there were so many folks at the table that usually don't sit at the table together. We had all the teachers' unions, we had the boards of education, we had the superintendents, we had non-education unions, we had early childhood advocates, we had charter school advocates, we had everyone at one table. And the lessons that we learned that mattered tremendously, number one, story matters. We had a story to tell. We didn't just show up and say education matters or early childhood education matters or pre-K matters. Everyone in this room or this virtual room knows it matters. That doesn't win you your political argument. You have to come with a story, and you have to have both anecdotal notes, but you also have to have data. And so what we talked a lot about was 3 main points. Number one, it's an equity argument. I do this work as a former teacher because I care, and right is right. I don't have to be convinced any other reason to do this, but a lot of legislators and a lot of other folks, maybe they need another argument, and that's fine. So there's also an economic argument to be made. Investing in public education, particularly early childhood education, yields unbelievable economic impacts. We commissioned a study, which I'm happy to share after I'm done speaking, that found when all of this is fully implemented, every cohort of students that goes through our new education system will produce an additional $4.5 billion over their lifetime of economic activity for the state of Maryland, above government, TANF, above food stamps, above taxes, everything. An additional $4.5 billion every single cohort. That alone brought a lot of people to our side. But we also have the equity argument of 52% of Black students in the state of Maryland go to underfunded schools compared to about 8% of white students. And we also know that in Maryland, the achievement gap exists, not just an economic achievement gap, it's obviously a racial achievement gap. And there's actually a larger achievement gap between high-income Black students and high-income white students in our algebra scores than there is between low-income Black students and low-income white students. So it's not just an economic gap. We have to be talking and putting race forward. It has to be a race forward conversation. And then the last part of a lesson learned with the messaging is there's also a civic argument to be made. Regardless of where you stand from any election, from what's going on now, something's not working correctly. And we need an education system to fix these problems because we can't continue this way if we're going to be a successful nation. Research matters. I have about a minute and a half more, but I want to really tell you this note. Because this is a really early childhood education focused organization and conversation, ECE matters a ton, but so do politics. And what we saw happen in Oklahoma was that there was a push for a lot of this education funding and reform that was polling at about 70-30 before the election and actually ended up losing 60-40. And it had to do a lot with taxes, and it had to do a lot with how we're going to pay for it. So you can't put the cart in front of the horse. So you need to do your research beforehand and figure out what are people in your state actually saying about it. And so in Maryland, early childhood education actually has a plus 66% favorability rating on all of the things we tested. Plus 66% is astronomical. But it was actually the 6th most popular of the 8 things we tested. And so we were able to link early childhood education up with the things that polled at 1, 2, 3, 4, and 5, created this coalition, and ECE folks won, but so did the vocational learning folks, and so did the teachers. And good news for everyone, one of the things we did test was the negative message of, you have enough resources, just use them smarter. That was the least popular. It was underwater when it was tested against anything else. So we're on the right side. We have the winning argument. You just have to be able to message it correctly and message it collectively. And then finally, coalitions matter, and so do politics. You have to live in the world as it is, not the world as you think it should be. Because if you're going to win, you need to build that world. But you have to get businesses on board. You have to have the, what's the economic impacts? You have to talk about taxes. You have to talk about equity. You have to talk about race. You can't pretend these things don't exist and hope you're going to get to where you need to be. Last slide, please. And so that success, we ended up passing the biggest education reform project, and what the majority leader in the Maryland House of Delegates said was the largest reform package since IDEA. And we passed it on March 17th. Our legislature shut down on March 19th. It was one of the last things they did. They stayed in session for 2 reasons: to pass what was called the Blueprint for Maryland's Future and pass COVID relief. That's how powerful our coalition and our work ended up being. Was we knew something was happening. No one knew what was happening, but we knew that the world was, kind of crumbling, and they stayed in session and risked their lives to pass this because it's that important for our future. And so we kept this collectively together. And while the governor vetoed it, we're going to override his veto the next time we meet because we had veto-proof majorities. We were able to still do other things. Like, we beat back $110 million in education cuts 2 weeks ago. We beat back potentially 200 million more cuts, which were proposed, which we've already organized around to prevent them from happening next time. We've beat back a lot of other small cuts on local levels. All of this stuff matters. And now we're organizing at the federal level to get the HEROES Act, to get those bailout funds. All of this is to say, we started small, we grew, we built those messaging components. Because we had the winning message, people joined us, and we built the most powerful coalition that Maryland's seen, probably in decades, to make sure that we got the win for kids, because this is too important of an issue and too politically powerful to sit on the sidelines. Everyone's budgets are about to be axed. You need to start organizing now to make sure education isn't the entity that gets cut. And the last thing I'll say, sorry, Catherine, the last thing I'll say is, we also don't want to pin education versus healthcare versus transportation. We need to mirror that national conversation around allocation of resources and start having those conversations about where is the money, why isn't the money flowing into the economy the way it should, and how do we make sure that those who have the money are supporting and putting back into the economy the same way that they may be benefiting from it. So, Catherine, I will end there. Thank you so much for everyone's time and attention.
Joe, that was awesome and a great perspective from the advocacy community. Could you just tell us if your message had to change or how your message changed in light of COVID-19?
Yeah, so our message has shifted a little bit, but not a ton, actually. Our message actually has been bolstered, not by COVID-19. Not like, great, we got it. We have a more powerful message. But the Band-Aid's been ripped off. We had to drag people kicking and screaming to see the inequities. We had to lift up every single carpet and watch all of the bugs crawl out and show people, like, look under here. Remember how you said this wasn't happening? Look, it's happening. We don't have to drag people anymore. They can now see with their own eyes the inequities that are just laid bare because of COVID. So we now incorporate COVID messaging into it, but keep the eye on the main messagings that, number one, pulled the best. And then are adapted for these arguments. And some of the things that pulled the best are a lot of the idea about college and career readiness, which isn't a surprise. The idea that educators deserve a living wage, that they don't need to get a second job. The idea that equity matters. People want to believe deeply in equity and put their money behind it. And the last is just timing. So we've really been able to incorporate this timing of the time is now. Look at all the stuff's happening. So our timing message has really been bolstered by COVID-19.
Yes, absolutely. I think we're all going to be facing some of these same conversations with our local and state leaders. So it's super, super helpful to hear that perspective and to hear some of the effective arguments that you guys have crafted. Thank you so much, Jeff. I'm going to ask us to advance to the next slide. And then I may ask us to move into the final slide, simply because I know you guys know how to ask questions, because I have a bunch of questions here to ask the rest of our panelists. But first of all, as I promised, here's that slide just showing how to connect. Please do connect with us. We would love to keep this conversation going. You guys have been incredibly engaged. And with that, I am going to ask a few questions, and I'm going to ask these of all of the panelists. If you would like to answer, please feel free. But there were some really great questions that came in throughout the webinar that I want to make sure we have an opportunity to address. So I'm going to start with a quick question from Karen Naiman. And Karen said, I worry about children who are dual language learners and their families getting served least. As there are reductions, staffing shortages, even fewer staff in appropriate languages, less opportunities to obtain interpreters and translations. With this just trying to get by mentality, how can we ensure children who are dual language learners don't fall behind? So I will open that up to some of our speakers and to see if they would be comfortable addressing that.
I can talk through this. So being in LA County, majority of our children are dual language learners. So we think dual language learners first, not last. So we're ensuring all of our materials are translated, and we are actually in the middle of putting together at First 5LA, along with our partners, of sort of how do we create a more specific response for dual language learners, both supporting the families, but also supporting the dual language learners. So we're going to put out some new professional development that's about dual language learners in the context of COVID, so that we're being a little bit more intentional for that population of children, because it is a specific support structure. We need to ensure that we're doing language development in both languages for those children.
Thanks so much, Becca. I really appreciate that. I have another question from Parisa, and she asks, what is your recommendation or plan for students with special needs? Special needs students might hurt more than other students with potential budget cuts.
I can talk a little bit about what we're doing. We have an Office of Diverse Learner Supports, and just like I shared information on our remote learning guidance documents for early childhood, there are remote learning guidance documents for diverse learners, and they're probably able to be accessed on that COVID-19 website. And it outlines how we are supporting diverse learners around evaluations and around supports. I do also want to just echo kind of what Becca said, going back to the conversation around English learners, dual language learners. Our website that we put up, the pre-e-learning, it has Spanish translation. All of our resource packets and information is English and Spanish available for all families too.
Wonderful. Thank you so much, Leslie. I'm going to do one final question before we go ahead and wrap up. This one is from Andrea Brunel. Are there any differences in the guidance that is offered for pre-K in public schools and community-based pre-K? In my state, pre-K and public schools are exempt from child care licensings, and schools consider their pre-K programs an educational program and not child care. And I'm curious, I don't know if Becca or Gigi, if you all would feel well poised to answer this question.
Yeah, so I can, and again, just talking about LA County, because as was noted earlier, it's very different local guidance. So in LA County, the health and safety guidance is for any sort of childcare environment, and that is everything from district-based settings, CBO, center-based, or home-based. And so in particular, we are following our LA County Department of Public Health's guidance for those settings. And in LA County, due to the nature of the outbreak here, it's more restrictive even than our state guidance.
Gotcha. Thanks so much, Becca. I just want to take a moment and thank all of our speakers today. You guys just put so much energy and information and thought into this. We have an incredible set of resources to offer folks. I also want to appreciate everybody who actually logged on. You guys asked great questions. There was great engagement the entire time. You hung with us for a full 90 minutes. Thank you. We know time is precious, and you spent some time with us today, and we so appreciate that. So I'm going to go ahead and bring us to a close, and I'm just going to say, stay safe, wash your hands and stay connected. We do want to continue this engagement and continue to support children and families all across the United States. So thank you all again. Have a great rest of your day, and hopefully we will talk soon. Thanks so much, everyone.